Good evening, ladies and gentlemen. I'm Ray Morden, and I'm a member of the WIP 2014 class.
And my name is Rory Beattie, and I'm also a member of the Washington Island Programme, class of 2013.
We're here today to outline a scheme that we think will help third level students adapt, and this is outlined in our WIP paper.
We started with a group of 10 students. We tried to find an under-researched, underrepresented, and under-addressed policy gap that we felt needed addressing. For us, this came to be the mental health issues that surround the transition from second level education into third level education in college.
Our scheme was developed from a similar scheme in Ireland called HEAR, Higher Education Access Route. I myself am a HEAR student. I receive many privileges for being a HEAR student, but I am a HEAR student because of socio-economic background. Because I have a low socio-economic background, I get the privileges of HEAR. However, the problem is that not everyone gets the privileges that I get. It was created only for people who come from a socio-economically disadvantaged background.
In fact, there is an enormous number of people who feel to enjoy the same benefits that Ray does. There's an enormous amount of people that slip through the cracks just because they fail to fulfill certain income-based criteria. I'd like to remind you, ladies and gentlemen, as you sure know, privilege does not safeguard against mental health difficulty. This needs to change. These people need to be supported. To draw from anecdotal experience, I myself had trouble with this highly stressful transitional period. I went to the University of Liverpool to do law, fresh-faced, 19, completely unprepared for what was in store. Didn't look at my curriculum, didn't do anything like that, and eventually I failed, had to drop out and return to Belfast with my head hung low. What we want to do is reframe the debate on mental health in the college environment. We want to move away from this dichotomy, this black and white issue of being mentally ill or being mentally healthy. What we would prefer is to open this up and instead refer to a continuum of mental health, a scale of well-being rather than this compartmentalization that was played before.
So the continuum is shown here, and the idea is to teach students where they are in the continuum. The idea here is that everyone is on this continuum. If people understand where they are, people understand that what they are feeling, we think it will help them adapt to third level, help them improve their situation. And this is the rationale behind their scheme, HEAD, the Higher Education Adaptation. So HEAD is a scheme that we're introducing to tackle the problem. The aim of HEAD is to support students in adapting to third level through a variety of supports. Ultimately, the goal is to prevent students deterioration of their mental health due to poor adaptation at third level. HEAD will be heavily based on volunteers and an alumni network.
So today we're going to illustrate the HEAR project, which Ray is a member of, and then we're going to take you through the evolution of this program to our model, HEAD.
Okay, so we're doing a bit of a scene for this today. We have 3 students here. We have Jack, we have Owen in the middle, and we have Laura at the end there. Jack will be similar to me. He's a HEAR student. Owen isn't involved in any scheme. He's not able to be involved in any scheme. Laura is a representative of a student that would be on HEAD scheme. It's very important to note though, HEAD is not available.
All 3 of these students have reached a period in their first semester of college and they're starting to struggle. They're struggling to keep their head above the water. They were unable to prepare for what was thrown at them in this new college environment, including curriculum unpreparedness, and they're starting to feel the pressure.
Luckily for Jack over here, he's a HEAR student. Jack has many privileges. He has someone to support him. We have an access officer, Yona, who will notice, he monitors the students, and he notices when things are getting hard. They look at grades. Jack will call Yona, and she'll start to tell them about what supports. Supports that Access offer are a variety, like they're huge. We have academic support, we have financial support. They give education about what support you can have. We have workshops, we have free drawings, free extra lessons, and you create a community that makes you feel more comfortable in yourself. As the Access officer walks with Jack here, he'll start to feel the pressure lifting, and he'll feel like he's more capable of going through college, going through this battle, because he doesn't feel like he's alone. And soon, Jack will start feeling more upbeat, and he'll start moving from the left side of this continuum to moving up it, and that's the idea of head.
Similarly, the lovely Laura at the end is a hypothetical member of the head body that we're proposing. Like Jack, she is also supported through this system. Her head officer will, like the HERE program, offer emotional support, academic support, peer mentoring, which is key. I'm borrowing from the Washington Ireland 2020 program. We've enjoyed a number of presentations and workshops from the Accenture group, helping us with things like CV building, interview skills and such. What the head model will adopt that same intensive practical model, except dealing with things like how to use a library appropriately, how to find the correct book, how to deal effectively with exam pressure. Aside from this, the value added that the head model wants to bring is the creation and cultivation of an effective alumni network. These alumni will be able to be pulled and drawn from for training purposes and such like that. A final thing I'd say about HEAD is it seeks to amalgamate the existing best practices in the national context in Ireland and Northern Ireland. We felt that we've effectively handpicked these best practices and have decided to centralise them in this one body, HEAD.
Okay, so the support here that Roisin is given is clearly lifting Laura, and it's improving her mental health. However, it's clear Owen, he's by himself. He has no support.
If HEAD was available in the real world, Owen here would be eligible for support, just the way Laura and Jack would support.
However, nothing like HEAD exists. He feels he's on his own. He's kind of right.
We did not prepare effectively for the college environment, and now he's being inundated with these new experiences. This is all starting to build up, and he's starting to sink.
He's finding adapting to third level very, very difficult. It's a huge challenge. We all know how big a challenge it is. A lot of us have been supported. I wouldn't be where I am today if it wasn't for the support I received. Owen needs help.
He can't find this help at all. His friends and his family are different ends of the country. He is completely isolated. And I remember this feeling. It's not pleasant. Everything is going downhill.
There's very few people to talk to. His mental health is deteriorating. And what's worse is Owen is at a very dangerous point in his life, where his mental health could be a danger to his life.
He needs support.
He needs a scheme like HEAD. Thank you very much for your time.